Medical Tourism Corporation Network Dentist Dr. Mauricio Grassi from Cancun, Mexico, discusses his professional experience.
My name is Dr. Mauricio Grassi. I was born in Mexico City and I studied in Mexico City, and I moved to Cancun 5 years ago. I've been practicing dentistry for 30 years, and I speak 4 languages. I speak Spanish, English, Italian, and French. I do pretty much all the general practitioner's procedures. That includes bondings, inlays, onlays, crowns, posts, veneers, bridges. I do dentures, complete and partial, and removable bridges. Crowns are needed to redo a tooth when it's broken or it has been badly damaged. You need something to reconstruct that tooth, and usually that's a crown that you use. It's made of different materials, from metal to plastic, but plastic usually are temporary crowns, and metals are no longer complete metal crowns are no longer in use because they look ugly. We use metal fused to porcelain crowns now, and plain porcelain or zirconia and porcelain fused crowns. Each crown has its individual use. It all depends if you're using a post or you're not using a post. It depends on if it's a front tooth, a back tooth, what kind of load you have. If you have to make a bridge, you need it for aesthetics, just aesthetics, or it has to work. All that influences the decision about what kind of crown you're going to use, or you should use. We use a Mexican-based Texas lab, but it's the only lab that we're found that meets our expectation. Veneers are used to restore the aesthetics on the front teeth. Veneers are just used on the front teeth. They can't be used on the back teeth. We use this Merida-based Texas lab because first, they have the quality we're looking for, and second, they also work with a lot of dentists in the States. Same way they work with us, they send the cases to Merida and they get it back by UPS in the States or in Mexico. I mean, they work for the States and for Mexico. Inlays usually are for small cavities. When you have to reconstruct a tooth without, and you have enough tooth structure to withhold metal or porcelain partial reconstruction, you use the inlays instead of using a crown. It's cheaper and works fine. You usually go to crowns when the tooth has been too damaged to withstand an inlay or an onlay. Well, bridges are used to restore the biting. They can be put in front or the back, it doesn't matter. Usually you use the bridges when there are teeth missing. You can't do everything with the fixed bridges because you have to adapt to certain rules. You can't do bridges too large or without a posterior fixture because they won't last. But pretty much you use a bridge. It's fixed or removable to a cover for the loss of one or several teeth. Yes, the composite bondings and fillings are just for little decays. I mean, when the tooth has been not very much compromised, and you can do it with small amount of material to restore it's a normal cleaning, ultrasonic cleaning, and everybody needs a cleaning at least every 6 months to remove all the debris that are under the gum, and you are not able to remove with a normal brush. You use an ultrasonic scaler to remove those debris. All the materials and all the instruments that we use here are sterilized in 2 ways. One is by heat, no, 3 ways actually. One is by heat, 2 is by chemicals, and also by ultraviolet light. It all depends on the instrument that we're using. It's the method that we're using to sterilize. We choose Cancun because it's a very nice resort. They have beautiful beaches, beautiful hotels, and everybody can have a really nice time here in Cancun.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.